everyone. Good morning. I'm so excited to be here, and I appreciate the invitation I received from Eduardo to join today. So I'm Jacy Farkas. I'm the director of the Sonoran Center for Excellence in Disabilities at the University of Arizona. We are a similar center as to DRPP here. We're a federally designated UCED, University Center for Excellence in Developmental Disabilities. I've been with my center for over 18 years now, but I've been in this role for the last year and a half. A lot of the work that I do focuses on the intersection of disability and other marginalized and minoritized communities. And so I'm excited to share a project that we've been working on for the last couple of years. We had a study that focused on really learning from those lived experiences about their access to disability services in Arizona. And we've kind of expanded since we've completed that initial study. And so I'm just going to share a little bit with you today about that project, the study, our findings, and some of the recommendations that came out of that study, and potential interventions that we're also starting to expand in some other, with some other partnerships that I'll share. But then I want to have some time for us to have a bit of discussion to hear from you, maybe what some of your experiences are and what you might be doing here in Utah in supporting refugees with disabilities, as well as maybe some of your thoughts on some of the interventions that we're potentially looking at implementing in our state. So we had a very large team that was part of this project. So I'm just here on behalf of many. So I was co-PI along with Dr. Julie Arman, who's one of our affiliated faculty at our center, she's a medical anthropologist by trade. And we had several staff as well as a bunch of trainees who had lived experience themselves of being a refugee, having been a refugee, and some of them also a refugee and lived experience of disability that were part of our project. And we also work closely with Dr. Summer Al-Dulaimi and Susan Teeple, so our UCED is also, we're housed within the Department of Family and Community Medicine in the College of Medicine at the University of Arizona. And so part of our larger department in FCM, on the clinical side, there's actually doctors Al-Dulaimi and Teeple. They lead a complex care clinic for refugees, and integrated into that clinic is it's called TFAP, Tucson Family Advocacy Program. So providing legal advice as well as access and supports to resources. And so the medical director is Dr. Al-Dulaimi, and the legal director for that program is Suzanne Teeple. And so they also worked closely with us on this project, given their expertise and experience working with refugees with disabilities and medical complex needs. Or I said that out of order, didn't I? So I can hear it coming out through. I will also disclose I'm also neurodivergent. So if you see me grasping for words at different points, or I'm like, oh wait, did I say that out of order? I'll get back around to it, I promise. And I'm gonna do my best for keeping time today. We have until 11, is this 50 minutes?
11:20.
11:20? Okay, perfect, thank you. Okay. So just a quick overview about the project. Our goal was we wanted to better understand how the diverse communities that make up refugees with disabilities in Arizona, how they're able to access and use disability services, and what might be some best practices to reduce gaps and increase access to these services for this population. And this started previously with our state DD Planning Council, our Developmental Disabilities Planning Council. And a few years back, they had started a Refugees Disabilities Roundtable, and we were part of that effort. But there was an initial study that they did, a report that was issued, but most of that all came from professionals, most of that data, and not but from folks with lived experience. And so the follow-up to this report is that they released a funding announcement around wanting to do some research that really prioritized the lived experiences of people and the data that was being collected. And so we were awarded that grant. And between October 2022 and December 23, we implemented this project, this research study. And we really used a multi-method approach and a community participatory kind of action type of methods as well that were incorporated into this study. We spent a good deal of time around community engagement for this project. And we had a community advisory board that was integrated and some developed in the beginning that included some key service providers, school personnel, but also some ethnic community-based organizations, representatives, as well as folks with lived experience, part of our community advisory board. And they met with us throughout the projects. They helped with planning and input, as well as some data collection. And they participated in how we kind of interpreted some of the data and landed on some of the recommendations based on the data that we had. So we kind of used some innovative methods here between group concept mapping. Are folks familiar with that method? So you'll see the results of this in a little bit of what that looks like. But it's a way of getting a diverse group of people, getting their ideas around a specific topic, and then being able to kind of structure those ideas by rating and them and sorting them, that we're able to produce these visual maps of what the data looks like based on everyone who's provided that input, to be able to kind of see the state of things based around that specific topic. And I'll walk you through what ours looks like here. But we did a mixture of online software to get information from professionals and caregivers. And then we did in-person brainstorming meetings with folks with lived experience in 2 parts of the state. And so in Phoenix and Tucson, which are our larger metropolitan areas and where most people are resettled in our state. And so we were able to get a lot of different input from different folks during the group concept mapping phase. And then the results from that with our CAB, our community advisory board, we were able to figure out what else we really wanted to learn from folks with lived experience through the interviews. And then we used the data from all of those, from the group concept mapping, the interviews, as well as some of we did a policy scan. Our trainees really helped with that to look at both legislative and state agency policies that are related. And together, we kind of triangulated all of that data to provide our recommendations. We did collect, we only got 3 responses, but we did send out a survey to all of the refugee health coordinators for every state, and to kind of see what they were doing and some of the best practices, but we only had 3 responses. So even though it came from our state's refugee health coordinator as well, and we still only got 3 responses to our short, but it gave us a little bit of context. And so, you know, We also had our policy, our train, because we only got so few, we had our trainees also look at practices across all of the states, at their policies and their websites of what kind of information was available. So just to kind of center us as we're about to go in, and especially with today's theme of honoring our intersectionalities, one of our participants, this was a parent, a mother, during our brainstorming sessions, that I don't know why they don't help us, whether it's race, religion, non-English speaker, refugee, are my assumptions of why we're ignored. They ignore us, and this increases our sickness. And so their family had a lot of struggles with accessing particularly mental health services, and had numerous instances with law enforcement that really had where there was profiling basically that was happening of her son. And so, you know, they had numerous cases of that, and a lot of several mental health crisis kind of situations. And she had been also not allowed to be part of some of those meetings. She was like excluded from a lot of that. So she was able to, I feel like her statement was so powerful when she said this during our meeting, of how you can't really separate all of these things out, right? How folks are perceived, especially by others around them here, particularly in the context within our country. So here is the resulting kind of cluster map. So I mentioned with the group concept mapping, it gives us a visual map. And so we had a statement that was like, what would really, my whole thing like blacked out. I knew I would need my presenter notes. That what would really help to improve access to services for people. And so there are a variety of different ideas that people came up with during our brainstorming sessions that were collected both online and in person from folks with lived experience. And each of these dots here, I identify as a single idea, right? So we had 89 responses, that unique ideas that were included as part of the process that folks sorted and rated. And so the further apart these dots were the less likely, the less they were sorted and grouped together, those ideas. And so our advisory group helped us to label what these groups of ideas were really expressing. And so these are the different clusters here that came out of that, that would really help improve access to services for this population. And so culturally responsive, accessible health and disability service and benefit systems, agency training and coordination about refugees and disability, community support, representation and mentorship, refugee rights and self-advocacy education, and language and resource access. And so I mentioned that there's rating as well, activities they did with this. And so there was a question on the relative importance, and then also current present. So how much is this currently happening? So there's different layers here. The more layers means for the importance map that this cluster, this topic was rated most important in comparison to the others. And then also similarly with how much this is currently happening. So agency training, coordination about refugees and disability were rated highly on both of these areas as it being really important, and that it's happening. Now we were surprised by this, because we're like, from what we were hearing, especially from those with lived experience, that is not what sounds like what was happening in practice. But given who may have responded to this, especially the online activities from professionals, they may have been part of an effort when that first report happened. There was a couple of trainings that happened, but it was like in 2019, right? Where there was a couple of trainings that were for cross services around refugees with disabilities. So if they went to that, they went, oh yes, this is happening. We've done that. We've been part of it. But it's not something that, from what we've heard from communities, that was regularly happening, even from those who were other professionals who were providing some of those services. But all of these other areas, which also was a surprise to us, were not rated as, I mean, these are all important things. So just comparatively, they weren't rated as important. And for the most part, most of this is not happening, is what folks were saying. And so to give you an idea of some of the items, the ideas that were coming out of this, and what we thought would be most helpful in trying to identify where the gaps are or things that we could take action on, we're looking at the items that were very important, but that weren't happening, right? So what are those things that we could really be looking at? And from across the different clusters, things came up about getting a timely diagnosis, having case managers who specialize in refugee care, and interpretation comes up everywhere. Having language access, we know that's going to be one of the most important aspects, right? Well, when it comes to having the CERT systems, the different agency staff, having coordination and training, some of the things that really popped up that were really important but not happening, education for primary care physicians and primary care providers about disabilities. A lot of these are things that we know are already an issue for the disability community. And what seems to be that it's further exacerbated by the other unique needs related to language and cultural aspects is what really came out of a lot of this, unsurprisingly. But also enforcing of the right to an interpreter for translated materials, and what came up a few times around training for law enforcement and border patrol, particularly where we are in Arizona. Tucson is only an hour away from the border to Mexico. Under community support, having caregivers and providers having caregivers and providers that come from refugee communities, having community members actually be part of the process, help with basically navigation, being able to guide others and serve as a resource and provide them to folks, and also Refugee Crisis Center. And I think these slides will be, we can probably share them. I see a lot, I hope I'm not going too quickly. I see folks trying to take pictures. I can make sure it gets to the conference organizers to share with people. Okay. Yeah. Making sure there's peer mentorship opportunities and growing that in some of the communities for parents, especially in how to navigate some of these systems, and having just that representation of seeing and having examples of folks with disability from the refugee community as part of various, campaigns and materials. Some of the things, just the cultural aspects. So not only for diagnostic activities to be culturally and linguistically appropriate and having services available in their languages, but other things that came up, particularly for refugees themselves, is training around more of an orientation and education around how disability is viewed here and what their rights are around that and the kinds of things they would have access to that maybe they didn't in their home country. And so with the in-depth interviews, and you'll see a few different pictures throughout of Amal. I don't know if anyone's heard of her. So it's this giant puppet.
She's a puppet.
She's a puppet. Yeah, it's a puppet. And she goes all over the world. She's representative of a refugee child. And they actually came through Tucson when we were working on this project, which was great. And we were able to capture some of these photos. There's a link about her at the end of the website or the slides. Okay. So lack of knowledge of individual rights and opportunities for folks with disabilities from this community. A lot of things that, again, weren't very surprising. That families require information about individual rights and opportunities, and to be able to get support needed to pursue education and employment. We had several participants who had children who were still in school age or had recently graduated and brought up a lot of issues that I think, you know, we've seen with a lot parents who and families who aren't part of the refugee community, but just the additional challenges of, you know, having some of the cultural and language access aspects that really came up. And where parents really didn't feel like they were listened to at all or seen as any kind of expert around even their child. That numerous times language access was not being provided for many of these meetings. They would even send an interpreter for a different language sometimes if they did actually happen to get an interpreter, or try to use other family members to act as interpreter. And so, you know, like I said, even if it was provided, it was often in the wrong language or dialect, even using some of the, services that are available. And I mean, without effective interpretation, it's just not possible for the staff to really meaningfully engage with folks. And the other thing that came up is that for families who had adult children with disabilities, so the child may be fluent in English at this point or can have a conversation, but the parents would really benefit from an interpreter, that they were refusing to get one for the family because the person received, the adult who was not under guardianship, could understand. And so not taking into account the full family and experience who's supporting their family member to be a part of the process. Some of the other things that kind of came up around family disengagement was really just how service systems interacted with them. Not only was the person who has a disability not necessarily included in their meetings, at times they were just presented with, this is what's going to happen. Here are the goals and everything that was planned out without their input. The biggest thing is the length of time to get services that creates additional barriers. So a lot of people like to come to Arizona because we don't have waiting lists. We're kind of seen as one of the states that are easy to become eligible and get access to. We have a single demonstration waiver, so for Medicaid. And so even if the process for a lot of the families that we spoke to get into to enroll with Medicaid and with our state DD system, the process was kicked back numerous times. And I mean, appeals happen often and people know you need to go, you just have to do it, rejections and appeals happen often. And unfortunately, sometimes a lot of the families don't want to move forward with seeking and doing appeals, when that's just a necessary part of the process. But oftentimes there were things happening where, because an interpreter didn't show up for the meeting and everything could be done within the days, now it's starting all back over again for the whole eligibility process. Things that were out of their control and not really was on the system side for why things didn't happen in time or the process correctly, that would start it all over again, or the denial to happen. The other thing too is that once they were eligible, the length of time to finally get services. There was one family we were talking to that they'd been meeting with their support coordinator, but it had already been 7 years. It took 7 years to actually get any kind of service. And so, which is not typical for most people in the system in our state, especially if you're living in a metropolitan area. That is not typical. But that was the case for many of the folks who we talked to, where it took a long time to finally actually get services, even though they were enrolled. And the other thing that was very clear is, the notion of just like more of a collectivistic view of not just for their family, but for their community as a whole. And so oftentimes, even when we were asking questions, it was never wanting to, I wouldn't say never, but often a response from our participants were really framed in a sense of, well, this is what our community needs. These are what we see is happening versus this is specifically what's happening with my child, an issue, or my family member, and how they can prioritize the well-being for their whole community. And there was just a lot of misinformation going on, for up until COVID, children under 18, parents could not be a paid provider for minors in our state. Under COVID, that opened up, and then there was a lot of advocacy to keep that post-COVID pandemic. So that was still in effect, but several families were being told that by providers that they couldn't do that anymore. And so, I mean, for one family, their teenage child who was also in high school had to miss school to go and do the training and do everything to become a paid provider so that she could be part of his care because the parents couldn't. So trying to make sure that families, often they want to be providing care, especially when you can't find someone who has similar language to provide care, and as well as just the cultural aspects, to want to have family be part of that, their services. So we really took more of an ecological view to our findings, and kind of both at the individual relationship and community and societal viewpoints of what, could really help best support these families for better access to services. And so some of our recommendations, and the way we frame that, we use Georgetown's National Center for Cultural Competence, their disparities framework on disability. So we really looked at how availability, accessibility, acceptability, quality, and utilization of services, and how we really interpreted some of our findings to make our recommendations. And so in terms of service quality, improve that, of course, the biggest one is to ensure language access, and that folks are adhering to language policies, and to find some other maybe innovative approaches outside of a standalone language line for interpretation. transportation also was another big issue, especially when most of these apps are how you request transportation. You get through, it's all in English until the end to finally maybe you could try to get, you can't request it in your own language. So like, it's really hard and inaccessible for folks to be able to even request transportation most of the time. For service quality, also, making diagnostic assessments more timely and linguistically appropriate. And because so much focus from our participants around educational issues, but how we can bolster those educational institutions to really effectively engage families from refugee communities, and to think about it holistically, right? So about the family's basic needs as well as appropriate assessment and support for the learners. Several things that came up when we met with folks, just the gatekeepers, even from ethnic and community-based organizations, that if they had bad experiences with certain systems, they were not sharing or passing those resources on, whether it was around vocational rehabilitation or other things that would be really helpful to some of the folks they're working with. And so and of course the primary care providers was another big one. A lot of folks are going to their doctors and rely and trust what they're saying, and several wanted to get the information about disabilities from their healthcare providers. And so how we can best educate those folks would be another recommendation. Again, education for refugee families around disability service systems and their rights, and peer support programs. And then training for personnel for case managers around disability focused refugee information, and having a DD navigator to provide sustained advocacy. Almost thinking of, and one of our potential interventions is thinking about how we could use even community health workers or others to serve as in that navigator type of role. So some of the potential interventions that we're working on right now with some of our partners in the state and nationally are focused on the DD navigators, having that. What's a DD? Sorry, developmental disabilities. I apologize. So saying like developmental disabilities. Okay. So the service system and being able to navigate access to developmental disability services. As well as healthcare provider training and training for refugee resettlement staff on disability. We did see an example in New York of how they're doing this well. And they set up, it's a partnership between their state developmental disabilities planning council and their office for New Americans, and having these navigators to help support folks as they access developmental disability services. And so something that we can look to how we might replicate or do that in our state. As I mentioned, we work closely with our clinic, and they are, Doctors Aldulami and Teeple are working with us, and oh my gosh, all these acronyms, USCRI. So they're they provide resettlement, refugee resettlement health services for like 9 states. And we're currently partnering with them to see how we can help create healthcare provider training around both the model that our clinic has for medical complex needs, as what are complex medical needs and working with folks with disabilities from the refugee and immigrant communities.
Did you tell part of that 9 states that you had helped train?
So we haven't done this yet. We're just starting. They're part of, I'm sorry.
Sorry to interrupt. I was just
Okay.
thinking on if you, is Utah part of that 9 cohort that?
But those trainings are going to be, our aim is to have these trainings available nationally to folks.
Cool.
So anyone could access them. And we'll be the ones hosting the, especially the online asynchronous trainings. We'll be hosting it through ours to be available to anybody. And then training for resettlement staff. And so we're partnering with our local, one of our local resettlement agencies to kind of pilot this and develop something. And so that's just getting going now as well. So I was trying to get through this a little quickly, so we actually had time for discussion, but we'll make sure you get the slides and I'll be happy to answer any questions and you can reach out. You know, one, I'd like to hear kind of some of your all's experiences, maybe working with refugee populations here in your communities and what that's looked like or what might be working well or other things that, you know, we might want to take into consideration that you all have seen makes a difference based on kind of some of what I shared today. Yes.
I have a question and I'll also provide a response to your question. But in the collaborations that you mentioned, I didn't necessarily hear anything about, say, a family-to-family health information center or a parent training information center. And I wondered if they had been something that you had thought about in your collaborations or if there's any connection with those folks.
There is, and that was just a lack on my part not mentioning it. But we do work closely with our Parent Training Information Center. In Arizona, it's called Raising Special Kids. They also have the family to family. They have all of the programs from them. And they do some work specifically with refugee families, and they were part of our community advisory board, both for the parent who led that effort. She was part of our advisory board for the study, but they're actually working in partnership with us in developing the training for the pilot we're doing with the local refugee resettlement agency in Tucson. So they're part of that effort.
I'm so glad to hear.
Yeah. So I'm sorry, I failed to mention them. Yes, but yes.
For us, I think through the work we've done, we've tried to connect at the ground level with people, not necessarily the resettlement agencies, but other groups that are reaching out to refugee communities, especially concentrated in the school setting. Here in our state, their Utah Refugee Connection. In addition to that, we also recognize the language access piece. And so we tried to very intentionally translate crucial material that we know are helping the population overall in specific languages of our own refugee community. But that is always an ongoing effort to make sure that that language access is happening. We try to do internal training with our staff when we connect with refugee families to be able to provide that support as well. But at least on the parent family end, those are some of the things that are happening in Utah.
That's great to hear. Yeah. Are you with the
Utah Parent Center? We're
Parent
both
Center,
the Family to Family Health Information Center and the
Okay.
Training Information Center. Yes.
Oh, great. Okay. Might come and chat with you later. Yes.
Yeah, my name is Dedi. I came to this country as a refugee myself. And since then, I've been working with different refugee communities. I like a lot of things that you mentioned. I was actually going to ask you about the recruitment process. Like, how do you recruit refugees, for instance, who have lived experience with disabilities into such programs? Because I'm a member of the advisory board of Multinet itself, and I'm supposed to reach out to people in the refugee community with disabilities so that I can get them to participate. But it was very difficult. I mean, it's very difficult. And obviously, it happened to you. You only got 3 responses from the survey that is sent out. So I don't know, but if there's any other recommendation how to reach out to people with disabilities in the refugee community, that will help. Because for some reason, it's just kind of treated like a taboo. People don't want to even talk about it. And so to get people involved is a problem. The other thing is you mentioned training of staff who are from the refugee communities themselves to be able to be a part of the people providing the service. Yeah, that's okay, but I don't think that's enough if we just get people with the refugee background, but they don't get the proper training, because I've seen that. They just say that, okay, you're from this group, and so we want you to come, and do this job, but they don't receive the proper training that they need to be able to deliver the service that they're supposed to do. So that is something that we may really want to pay attention to when it comes to the training. And then the last point I want to make is the for instance, you mentioned sometimes an interpreter may not show up, or there may not be an interpreter at all to help people who need translation into a different language. But then, if the top leadership does not have a buy-in into this idea, because a lot of these things are associated with costs. So the person on the top, if the person in the top does not believe in this at all, so they would not invest in getting interpreters or whatever it is. So it's also important to make sure that top leadership is involved in the whole process, so that they understand the need and the value of, for instance, getting an interpreter. Otherwise, it's just not gonna.
No, and I agree with you. And even when it's written in policy, or as well as, I mean, it's there, yeah, there's laws and regulations, but then even if you're a provider, it's in the contract in order for you to do it that says you have to provide it, but it still doesn't happen, right? And so how do we bridge that and get folks to. So a big part of it is like the accountability processes, right? And how do we ensure that those mechanisms are working? Folks even talked about what are are there existing feedback loops? If not, how do we create that that are taken seriously, right? So I take your point, absolutely. And then to answer your first question, we worked really closely with a couple of ethnic community-based organizations. So like in Phoenix, it was the Somali Community Resource Center. And they provided programming there for folks. And not just for individuals who are Somali, but also other refugees. So they had different programming going on that we were able to work closely and build a relationship with them for them to help us host the event, and for them to help recruit families to come and participate in the activities, because they knew who had disabilities, and they knew who had some of the designations for when they came through, that they were able to ask and reach out to families of, would you be willing to come and participate? And so they were trusted and already in those spaces. And so we went to them. So they hosted it, and we were able to do that both in Phoenix and in Tucson. And the one in Tucson, she set up not only a community resource center, but has multiple like provider type of services herself. And she has a background of being a refugee, and providing disability services and having resources available. We had her as part of an advisory board, and she was able to reach out and host also an event for us at her center. And she has her own like interpreter service as well. So that, we were able to have interpreters at both of our, at all of our in-person kind of service meetings, not service meeting. I hate to call them focus groups because they were not focus groups, but our brainstorming sessions that we had with folks for the data collection. We were able to do that. I mean, the one in Phoenix, we had like 3-4 different rooms going with different language-based groups happening to get input from folks there. So we spent more time building relationships on this project than anything, to make sure that we were talking not only to the right people, but spending time in those communities so that we could be part of and have people be willing to participate. And for a lot of the families, they were happy to see that there was a group actually concerned about disabilities and their access to things. And they're like, yes, please share this with the state. Like, they wanted these things to move forward, to say what's really going on, and hopefully that things could improve. Yes, ma'am.
I hate to bring this up only because I don't know all the information. I was on a webinar yesterday about hosting events for disabilities, or to involve disabilities. And there is now a way to do surveys that will open it up to different languages, to American Sign Language, to even reading you the text and things. Because that's one of the biggest problems with the whole disability society, which would also go through refugees, is surveys are in one way. Well, what if you don't talk that one way?
Right.
But it is now available. But unfortunately, I don't have all the exact details. It's coming. But I can give anybody my business card and I can forward that to you. But that was news to me.
Okay, yeah.
And it is, I mean, they showed it on Google, but that's not the only. But it was just fantastic, because that is such a neat idea. Because we're missing out on so many people to respond to a survey or to join on an event if they can't respond.
And I'll say this was a relatively small budget for this 1-year project that could have easily eaten up everything just from language access alone. So we had to pick and choose what we could do. So none of our online or survey data that we did, those were only in English, and mainly because those were all geared towards professionals. But everything that we did in person and our interviews, we had an interpreter for available for all of our participants. But you bring up a good point. I mean, but when I think it also showed, and we put this in our report back to the fund. I'm like, if this is what you get when there isn't the dedicated funds to realize the access level that's needed to reach these communities. So we actually gave that feedback as well, because you can only do so much or reach so many linguistic groups when you don't have a large enough budget for language access. Yes.
Where's your funder? I may have missed that.
Oh, it was the Arizona Developmental Disabilities Planning Council.
Nice.
And you had a question?
Yeah, I think I'm Lily Griman. I'm also from you said in Montana. And I'm just thinking a lot about the value that you're talking about of relationships, the time and how hard it can be, and thinking about strategies as it's likely getting harder and will be getting harder. I imagine refugee communities are frightened to talk to people and wouldn't want you to share their information with the state. And so I think this is something we want to talk about in our presentation too. Like how do we in this kind of shifting time where maybe we aren't actually loud, like maybe we're not wanting to put a vulnerable person forward to demand access to their rights if the result could be that they're deported, right? So how do we navigate that, right? And I think those relationships like that you mentioned and building those are probably so important right now. So that's probably it's about seeing what are people's needs now And it's hard when you're like, wait, we could do this, but can you? Like, what are the, or I guess my question is, sorry, like of the interventions that you've identified, are there some that seem that you could dive into now? Or are there others that you would maybe step back from? Like, what feels?
Yeah, we actually just had this conversation yesterday, or because you know, with the grant that we submitted that would fund us working with USCRI and developing the healthcare provider training and resources. What was interesting is that they asked us if we had an issue with language or how reaching, if we thought any of this was still doable now, given the context, because we had submitted this a long time ago, and now we're in like the rounds where we're going to meet with, you know, the boards and stuff of the foundation. And so, but right now, I mean, we're not getting any new resettlement, but I think this is actually a prime time because there's still so many people who are already here who need assistance or access to services. What can we do now? How can we provide, especially training and education to those who are here and still seeing folks from this community, right? And so that's how we're focusing and framing it. And you know, the approach that we've been taking is that, I mean, are you even saying the word refugee? I'm like, well, yes, I don't know how you can do the work without it. But they've been told by other partners that they're kind of backing away from certain language. I'm like, our entire center, like everything we do is like, I can't change that. I mean, though there's DEI words just in our name, like I can't change that. So we're doing the work and we're continuing our mission. And so, until somebody says otherwise and cracks down, I guess. But like we are, I mean, we see it as what can we do now within the constraints we have. And so however we can develop resources that will help communities still try to access information. We, you know, not specific to kind of these projects and study, but even to I know our staff, we provided all the resources to be like, here are things in a couple languages of rights. So if you see or hear anyone we're providing services to, give them this so that whether it's because of Border Patrol or ICE or whatever, that like they have something that they know what their rights are in their language. So we're trying to at least equip people with resources as much as possible.
Yeah, that education and self-advocacy, like for in a scary case where something happens that you have, and you know someone you could ask.
Yeah. So I mean, we're but again, it's about the relationships and continuing to do that even now. I think more so now. Hopefully I answered your question in some way. Yes. Any other comments or questions? I think are we at time?
We're all
We're about
hungry.
there. Maybe
Okay, one more.
Yeah,
last one, Betty.
yeah, okay, it's interesting, the point raised, the last speaker, sorry, I didn't catch your name. Yeah, but here in the state of Utah, what we're trying to do with the refugee community is to let them know, or to try to lessen their anxiety, because you mentioned misinformation and stuff like that. But there is a distinction between refugees and other immigrants in that they are, you know, documented because they're here legally. So this process with the new administration is not so much going to affect them, but still the information that goes out there is scary.
Yeah.
So what we try to do is just try to let them know that yes, there's this situation, but it's most likely not going to affect them as much as it's going to affect, for instance, the other groups. So this is what we are trying to do here in the state of Utah.
Yes, thank you. And since we are wrapping up, I just wanted to make sure that, and I can give you the slides, right, to show? Yeah. But then the full report for the study is available, as well as a plain language summary. And we have a resource hub. We're kind of housing it for our refugee disability roundtable, where we have like different materials in multiple languages available. and that kind of direct people to some key programs or services that would be helpful. And soon we're gonna have some of the fact sheets that are being turned into like audio videos of someone reading it in the language. So if they're not they may not be fully literate in their language, but it'll have a QR code that will have like a YouTube video of someone reading it from their community. So we're having several of those developed right now for both our special education fact sheets and our employment ones that the roundtables put together. So that's all housed here. But feel free to reach out to me. I'd love to hear more about what folks are doing or ways to collaborate. And then the walk with the mall is there too. Maybe she'll come through.
Or at least in January. Jacy, thank you so much. This has been such an important conversation. I'm really glad that we can have it. I feel like there's a lot of us right now kind of in that awkward, like, what are we going to be doing in the next few months or even year? And we just don't know. And we just keep doing our best. So thank you all for being here and for participating.